Good afternoon, everyone, and thank you for joining us for this important webinar on the impact of potential Medicaid cuts on students and schools. I see that more people are continuing to join, but we welcome you all. My name is Jennifer Tani, and I'm the President and CEO of Healthy Schools Campaign. Healthy Schools Campaign works at the intersection of education, health, equity, and sustainability. We know that healthy children are better learners, and we advocate for school environments to support all facets of children's health. A healthy school environment includes accessible, healthy, and nutritious school meals, physical education and physical activity, healthy school buildings and clean indoor air, a nurturing and inclusive environment, and of course, health services. Ensuring that all students have access to comprehensive, sustainable health services in school is core to HSC's work and to building a positive, thriving school environment. At HSC, we advocate for all students to have access to sufficient and sustainable health services. And this is where Medicaid plays an especially critical role. As you will hear today, Medicaid funding is integral to schools. Medicaid funds services for all students, including students with disabilities, students with mental and behavioral health needs, and students with chronic conditions. Reductions or cuts to Medicaid will have a devastating impact on students and schools. Congress must reject Medicaid cuts so all children can obtain the health services they need to learn and thrive. HSC is committed to protecting Medicaid funding that supports children's health and well-being. Before we go any further, I want to acknowledge something that happened yesterday that will impact our students, our educators, and our schools. Drastic cuts were announced at the U.S. Department of Education. These tireless career staff are an invaluable asset to the education of our nation. Right now, we're still trying to make sense of what's happening and how we can support education staff at all levels. It's hard news to accept, and it weighs heavily on us today. But we stand with the Department of Education, its staff, and with educators across the country. I'd like to thank our national partners who helped ensure broad participation in the school district survey that we'll be sharing with you today. And to all of you joining, thank you. We need everyone, no matter what your role is or where you live. We are all in this fight, so together we can protect our students, our schools, and communities. And now I'll turn it over to HSC's Policy and Program Manager, Allison Paxson, to walk us through today's agenda.
Thank you, Jennifer, and again, welcome everyone to today's webinar. Before I review our agenda for the day, I want to mention a few quick housekeeping items. First, this webinar is being recorded. We will send out the recording slides and additional resources after the webinar. Second, both the chat and Q&A features are enabled for this webinar also. If you would like to ask a question, we welcome you to do so at any time, but do recommend using the Q&A feature to ensure it does not get lost in the comments in the chat. We'll do our best to answer all questions in real time, but if we don't get to yours this afternoon, we'll be sure to follow up with you after the webinar. And so for today's agenda, we'll start off with a brief overview of proposed cuts to the Medicaid program. From there, we'll share the results from our 50-state survey on how Medicaid cuts would impact students in schools, which was released today in a new report. Then we're so grateful to be joined by a panel of 4 outstanding school district leaders who will speak to the impacts they expect to see from cuts in their districts. And then our last speaker will share advocacy opportunities and strategies to protect Medicaid and schools. And so I'd first, moving on to the next slide, just like to share some brief context on why school health services are important and how the Medicaid program plays a key role in supporting schools to provide them. Research shows that school health services improve student health outcomes. 1 in 4 children has a chronic physical or mental health condition that affects their ability to succeed in the classroom. And many children go without regular screenings, preventative care, therapy, disease management, and other health services. Meeting children where they are each day, providing access to health services in schools can reduce barriers to access and improve health outcomes. We also know that student health services improve educational outcomes. Healthy students are better learners. Children with unmet physical, mental, and behavioral health needs cannot learn to their fullest potential. Access to health services in school is proven to reduce student absences, boost literacy and math skills, and improve graduation rates. Even when just one student experiences health-related barriers to full classroom participation, it can negatively impact the learning environment for all students. So overall, the research consistently demonstrates the essential and ever-growing role of quality school health services in promoting the success of all students in the classroom and beyond. And so if we move on, what is Medicaid? Medicaid is a health insurance program for 1 in 5 people in the United States. Medicaid and the Children's Health Insurance Program, or CHIP, cover almost half of all children in the US and guarantee children comprehensive coverage for all medically necessary services. School-aged children, in fact, comprise nearly 1/3 of all Medicaid enrollees. A key feature of the Medicaid program is that it is a shared state and federal partnership, and the total cost of the program is split between federal Medicaid and states. This is a really important feature when considering the impact that cuts to Medicaid at the federal level would have on states and schools. And so moving to the next slide, that's really, and that really pinpoints how Medicaid truly plays a unique and critical role in schools. For more than 30 years, Medicaid has supported the delivery of health services to students with disabilities by paying for the physical, mental, and behavioral health services necessary for equitable access to educational opportunities. All 50 states rely on Medicaid to cover the cost of these services. Medicaid also supports all students covered by Medicaid. Even if a student doesn't have a disability, Medicaid can pay for needed physical, mental, and behavioral health services that a student needs to learn and thrive. And so all of this has really cemented Medicaid's critical role for schools. And today, Medicaid is the 4th largest federal funding stream for schools, supporting $7.5 billion of school-based health services every year. This funding is significant for schools and bears considerable weight in school district budgets. Overall, school Medicaid funding benefits all students and is vital to local communities. And so before I turn things over to my colleague, Jessie Mandel, to review the results of our survey, we want to provide a quick overview of the potential cuts to Medicaid themselves, which are currently under consideration in congressional budget negotiations. And so if you move to the next slide, we're so pleased to have Lena O'Rourke, who will share more about what is happening at the federal level on behalf of Healthy Schools Campaign. Lena, thank you so much for joining us.
Allison, thank you so much for having me today, and to all of you for taking the time out of your very, very busy days to join us to hear about what's happening to Medicaid. And my job is to really ground you in the reality and the urgency of this moment and the why we're having this conversation. And I'll do it quickly and hopefully pretty simply, but we're happy to answer questions later on or through the chat. So here's what's happening. Congress is engaged in a budget process that's known as reconciliation. You may hear about it in the news, you may see it. What this does and why they do it is if they're able to agree on a reconciliation package, the Senate only needs 51 votes to pass certain pieces of legislation, just a simple majority, which makes it much simpler for the Republican majority to pass their bills and their agendas. This is a process that is separate and distinct from the continuing resolution that we're hearing about in the news this week. This is the budget resolution and reconciliation process. All really nerdy budget process stuff, but this one is pretty focused on this reconciliation package. What happens is that each chamber, both the House and the Senate, pass a budget resolution, and they have done that. That's the first step in this process. And these budget resolutions put out very high level numbers of how much each committee of jurisdiction must either cut or that they may spend. These are budget processes. So all of the policies that will eventually be considered must have a fiscal federal budgetary impact. So in the budget resolutions that have passed in the House and the Senate, the House has directed the Energy and Commerce Committee to cut at least $880 billion, that's billion with a B, from the programs under their jurisdiction. The Senate Finance Committee has been instructed to cut at least $1 billion. Again, 880 in the House and $1 billion in the Senate. And why do I highlight these specific committees? It's because they're the committees with the jurisdiction over Medicaid. So as the committees begin their work and think about what their package of cuts may be, those two committees will have the power to cut the Medicaid program. And with cuts so deep, they must hit their numbers. Medicaid is very much on the table for cuts. Now, we do not know what the final target cut numbers are. They have not gone between those two bills and agreed on a plan to go forward. But it doesn't really, I mean, it matters a great deal, but there's, and we need to eventually know that target number. But I think if we take a step back and look at the fact that these committees will be mandated to make cuts, and that Medicaid continues to come up on the menu of options for cuts, these cuts to Medicaid are real, they are substantive, no matter what the number that they end at. And they will happen. They will have to move these policies forward. And as we will talk about throughout this whole webinar, a cut to federal Medicaid has dramatic implications for states, for school districts, and for the people who rely on Medicaid for care. The decisions are happening now. This is an ongoing conversation. Committees are talking, they're figuring out their process, and they are listening very strongly to what their constituents are saying. So this is the moment we find ourselves in, and why these survey data are so important, because they really do underscore why cuts to Medicaid federal cuts to Medicaid are bad for the states, are bad for the schools, are bad for the school districts and taxpayers, and for the students who rely on Medicaid for their care. So let me pass it back, Allison, to Jesse to talk about this survey. But when you listen, remember, this is the moment we're in. Medicaid cuts are on the table. They are profound and deep, but we still have the ability to educate members of Congress about the importance of not cutting Medicaid. And we'll offer some opportunities on how to do that towards the end of this webinar. Jesse?
Thank you so much, Lena. My name is Jessie Mandel, and I'm the National Program Director at Healthy Schools Campaign, and I'm very excited to share the results of our recent nationwide survey of school district leaders about the impact of Medicaid cuts. And as you'll hear, these survey results really underscore the significant consequences of the federal budget proposals that Lena was discussing and the implications for our students in schools. Between January 23rd and March 3rd of this year, Healthy Schools Campaign distributed a survey with 4 other national organizations: the School Superintendents Association, the Association of School Business Officials International, the National Alliance for Medicaid and Education, and the Council of Administrators of Special Education. In this survey, we asked school leaders how they currently use Medicaid and what would happen if Medicaid is cut. And we received a tremendous response from a range of school district leaders, including superintendents, school nurses, school finance officials, and more. A total of 1,440 school district leaders from all 50 states and the District of Columbia completed the survey. Next slide. And when we asked districts how they currently utilize Medicaid funds, districts were clear. Medicaid is a critical source of funding. 86% of districts said they use Medicaid to fund the salaries of health professionals. and specialized instructional support personnel, including school nurses, school psychologists, speech language pathologists, occupational and physical therapists. Over half of respondents use Medicaid funds for mental and behavioral health services, and 46% use Medicaid funding for assistive technology and specialized equipment. What's more, over half, 60% of districts reported that their Medicaid funding has increased over the last 5 years. And this correlates with recent federal and state activity that has helped states maximize this critical funding stream. Next slide. But if Medicaid is cut, survey responses overwhelmingly pointed to the devastating impacts and choices the districts would have to make. 80% of school districts said they would have to cut staffing for health professionals and specialized instructional support personnel. 70% said they would cut mental and behavioral health services, and 62% said they would cut student resources, including assistive equipment and technology for students with disabilities. And if we go to the next slide, here you can see the full range of survey responses and what services would be cut. And in our analysis, we found almost three quarters, 73% of respondents said that they would be forced to make cuts in at least 3 of the areas listed here. Next slide. And while cuts will have an impact on all districts, rural, urban, and suburban, cuts will be especially felt in rural communities. Almost half of the survey respondents were from rural districts, where more children are covered by Medicaid and where schools play an essential role in providing healthcare due to long travel distance, limited connectivity, and a number of other factors. As one school superintendent noted, due to the remote area we serve, our students have little to no access to medical services other than those provided in schools. Loss of Medicaid funding would severely hamper our ability to support our students. Next slide. And it's so important to stress, Medicaid cuts would not just impact school health services. Cuts will impact all areas of a district's budget. Across rural, urban, and suburban regions, 90% of respondents anticipate that Medicaid cuts would lead to cuts across their district's budget. Medicaid reductions would lead to budget gaps and require districts to divert funds from other educational programs to cover services mandated under the Individuals with Disabilities Education Act, or IDEA. In order to not eliminate other vital programs entirely, states and school districts will be forced to increase taxes to make up the difference. And we heard this again and again from survey respondents. As one superintendent said, lower Medicaid reimbursement simply shifts the burden onto local taxpayers. The consequences of Medicaid cuts would have a negative ripple effect across districts and entire communities. Next slide. And still, many other themes emerged too. We heard from respondents across all regions and states that Medicaid cuts would have wide-reaching impacts, including negative effects on academic outcomes and attendance, staff burnout and reduced quality of services, reductions in prevention and the availability of care, and family financial and emotional strain. We heard these themes and others because of the many school district leaders who shared their insights, who gave their time to support this survey, and we're so grateful for them. Which is why I'm so grateful today that we're going to be able to bring together a panel of school district leaders to expound on these survey results and share their expertise with us. So if we go down to the next slide, I am very excited to introduce our 4 amazing school district leaders joining us today to discuss how Medicaid makes a difference in their work and what would happen if schools lose Medicaid funding. So let me first introduce all of our panelists briefly, and then we're going to dive into some questions. Joining us on the panel, we have Shauna Dittman, who is the supervisor and planner coordinator at Monroe County Intermediate School District and the president of the National Alliance for Medicaid in Education. We have Dr. Heidi Seip, Superintendent of Umatilla School District in Oregon and representing AASA. We have Joe Quiz, who is the president-elect of the Council of the Council of Administrators of Special Education and a Special Education Administrator in Indiana. And we have Heidi Kearns, who is the Chief Financial Officer for Asheville City Schools and representing ASBO, or the Association of School Business Officials. Thank you all so much for joining us. I'm really looking forward to the discussion and just appreciate you all joining us with your busy schedules. So now I think we can take the slide, the slide down. And Shauna, I'm going to start with you. I'm hoping you can share a little bit about your district and role, and then tell us how Medicaid funds have allowed your district to address the how Medicaid funds have allowed your district to address student mental and behavioral health needs, and really any impact you've seen in your district and in Michigan.
Thank you so much for that introduction. Yes, my name is Shauna. In my current position, I'm called a planner, coordinator, and supervisor. What this means is I provide a lot of training and technical assistance specifically related to compliance with IDEA and the Michigan Administrative Rules for Special Education. I also provide compliance and technical assistance related to the Medicaid School Services Program. And I'm a principal at our Center for Adjudicated Youth. So we have court-ordered youth who are residential, and I'm the principal there. I supervise occupational therapists and physical therapists and non-public speech therapists and teacher consultants. So I have some varied experiences in the school setting. A little bit about the area based on our fall count. We have 16,305 general education students. We have 9 local school districts, 2 public school academies, 10 non-public schools, 12. I'm not sure. We expanded that as well. And then 3,173 or so students with disabilities. So in Michigan, around about 2019, October of 2019, Michigan's expansion efforts came to fruition. And at the time, we were able to, with the funding available, we were able to hire 2 Medicaid mental health consultants. And this was hired through our intermediate school district. The way we operate here as an intermediate school district, we hire a lot of support staff that are then kind of pushed out or deployed to the local districts. The local districts also hire some of their own staff, and they are starting to expand that as well. But we hired initially when this first became available as an intermediate school district, and we said we would provide support to our local districts. Well, as you can imagine, the mental health needs continue to grow and grow, especially when you think of the timing of our expansion. So the state of Michigan continued to provide the funding and even expand the funding available in our state. And so now where we stand from 2019 to present, we have 8 mental health consultants. It will be 9 in the fall. We're hiring another position. So that means that every one of our local school districts potentially could have their own mental health consultant. And so we'll be serving all 9 of those districts in our county with those 9 available consultants. This school year alone, we received 255 referrals for mental health services. And then since using we partnered in the state of Michigan, we use a particular vendor. And since our work with them began in September of 2021, we've received just under 1,000 referrals. The top 4 referral reasons for the 24-25 school year are depressed mood, anxious, negative life events, and trauma. So if we did not have this funding available, or if the funding were to to decrease or go away entirely, we would not be able to provide those critical mental health supports to students in the same capacity that we are now. Not only do we provide the individual therapy to students, we also provide training and support to our county schools. When we look at suicide assessments or threats of harm to self, or even behavior threat assessments and management of threats or threats of harm to other people. So we train our local districts in that as well. So really, this growing team, has kind of a twofold goal. One is to provide the critical direct mental health care to students, as well as increasing the capacity of our local districts to support students who have mental health challenges. So really a major focus has been providing evidence-based professional development and learning to our local teachers, all of our support professionals, and to our administrators. So just thinking about the fact that what would have happened with those 1,000 referrals without a team being able to navigate that, and the specialized skill set of those mental health consultants that we are extremely fortunate to have available to our county. So I hope that helps, Jesse.
That's great. Thank you, Shauna. And yeah, I mean, that's incredibly important. We heard really loud and clear in the survey results that mental health services will be cut, and that districts are really using their Medicaid funds currently to support mental and behavioral health services. And I'll say that Michigan was well represented on the survey, so we really know that it's making a huge difference across the state there. So turning now just to another data point that really jumped out at the report was the importance of Medicaid in rural areas. So Dr. Sipe, I'd like to now turn to you for a few minutes just to hear from your perspective, from the students that you serve in a rural community. I know you're going to share a little bit about that. What's the impact of Medicaid and what's at stake for rural students and schools if Medicaid's cut?
Thank you. I appreciate the time today. I think that in rural areas, it's important to note that we often lack access to providers that may be more readily available in urban areas. And so, for example, when we look at licensed counselors in our zip code, we find that they are employed in a few different areas. Number one being the prison. We have a state prison in our community. Number two is a facility that houses the criminally insane, for whom prison is not an appropriate choice, but they still need intense services, and our schools. That's it. We don't have private providers in our direct community. And so it's essential that we recognize the really important role that our school counselors play, but there's limitations to what a school counselor can do for services. And so through our Medicaid funding and through the very important billing adjustments that happened recently at the federal level, that now we can plan for and start billing for some additional services, direct services, we were able to hire this year a licensed board certified behavior specialist or analyst, and so a BCBA. That role allows us to provide more intensive services for students that have extreme behavior needs. And then we have continued to support our partnerships that we have with our local doctors so that when students are ill at school, we can take them to those appointments. If it's something basic like a potential ear infection, we can call parents, say, hey, you're registered with our system. We'd like to take your child to the doctor today. We have an appointment this time. Would you like to meet us there? Would you like to come pick your child up? Or would you like us to take them for you? And that's a great resource that we were able to provide. We get the students there in vehicles that we were able to purchase with the MAC funds that we received from our Medicaid administrative billing. And so those services are very essential. But I think the thing that often gets lost is the actual student impact. And so this morning, much of my morning has been spent by a student in crisis. This is a student who, in the fall, we were actually alerted by the FBI that this student had some pretty serious safety concerns being exhibited on the internet. They didn't realize it was a student at first. And so we got that through the police working with the FBI and then through us. And if we were to rewind about 5 years ago, that student would have been expelled. That just would have been the only option that we would have had. Instead, because we had funding available to us through our Medicaid administrative billing that we could use to pay for outside resources, We were able to send that child to a facility in Portland for a full psych eval. We were able to understand the needs of that child. We were then able to schedule our BCBA with that student on a regular basis. And instead of being out of school, he's been in school this entire time. And today, when there was a concern, instead of immediately moving towards something extreme, we were able to pull in his counselor so that when we are dealing with a police situation today, but instead of it being the student is now out of the system, it's instead a conversation of here's the supports that we know we have available. These are the things that we can now do. And it's a team effort to support that child and keep everyone safe. Whereas before, that just wasn't possible. And I'm very fearful of coming this far and then having to go backwards, because we really are serving students in rural areas in ways that we just were not able to previously because of access concerns. We've built the structures that we needed with these funds and with the potential to bill and receive more. And so to think about that going backwards is pretty disheartening.
Thank you so much for sharing that, and for just the incredible work that and the infrastructure that you have built to utilize the Medicaid funds and to support students in that way. So yeah, thank you again, and recognize that you're dealing with a lot today, and also appreciate you can share the story with us. Yeah, and I see some questions coming in the chat. I just want to acknowledge that everyone here on the panel, you're all in districts that are billing for students with IEP services, but in different stages of billing for 504 and gen ed students. And that really represents what we heard in the survey, where all respondents were billing for services for IEP students, and around half and slightly less than half are billing for 504 and general education students. So just wanted to share that data point too, to kind of reflect the responses that we heard from this survey overall. With that, actually, Joe, I'd like to turn to you because you're in Indiana's in a unique position in terms of their Medicaid billing, but also just given your role. So, we've heard in the survey, we know that the districts are required to provide services to students with IEPs. But we also heard that the cuts are going to affect the ability to serve students across the board, and really create a ripple effect and also impact services for students with disabilities. So I'm wondering if you can talk a little from your position and your administrator role and from the role of CASE, how you see the cuts affecting students with disabilities and what would be the impact in the districts that you serve.
Yeah, absolutely. And Dr. Saib, thank you for the great lead in, because, my day job that pays the bills, I'm an executive director at an interlocal serving 5 rural school districts. So we have about 6,500 kids in total, student population. And of that, we serve about 1,300 students with IEPs. So in our rural area, we run a little high compared to national average. We're well over 20% of students with IEPs in our schools. So, in any given building, 1 out of every 4 or 1 out of every 5 students walking the halls has an IEP with some kind of services in it. And I find that when you break it down, that kind of math really hits home to people that don't think about this a lot. So I won't go much into what Dr. Slipe did already, because you hit the nail on the head. The struggle is real in rural schools. But, we look at this from more of a global approach, nationwide. Medicaid funds account for about $7.5 billion worth of school-based services across the United States. That is a very large pot of unrestricted funds that schools can use to meet the needs of students for however they go. Any of our superintendents or CFOs or anybody who works with money on the call here today would appreciate that, there's just not a pot of money sitting around waiting for a purpose in most of our school districts. And having access to Medicaid funds really gives us flexibility to provide whatever services are needed when they come up. Basically every grant we have, every dollar we have has some sort of allowable cost tied to it. And a lot of times we can't use that money for things like when parents don't have access to mental health services, or when caseloads get so high we have to bring additional support in. locally, boots on the ground, some things that we've done this year, all of our elementary folks out there on the call could probably attest to this. Kids are coming in with very limited core strength. They have fine motor challenges, and we have such a need for OT and PT right now that our therapists are being overwhelmed. So we've hired a team of occupational therapy and physical therapy assistants to join our licensed professionals that are providing these services to help offset some of the workload there. So that was a need that's really come up post-COVID and has really kind of peaked here this year. So without Medicaid funds in the mix, we're not able to bring on that additional staffing to meet the needs of our kids and get them from point A to point B. That's huge for us. We've seen a large increase in the number of students identified on the autism spectrum. So having Medicaid funds enables us to have autism consultants in the mix for our students and families. People would argue that Part B funds can be used for this, and you're 100% correct. But again, that pot of money just isn't sitting there waiting for a purpose. Most of us have maxed out all of our Part B entitled dollars already just to keep the ship afloat. So to say that we have money waiting for that is an absolute fallacy. And if we pull money from one grant, it's taking services away from something else that's in place. So every dollar out there is we've got to guard it very much. We look at specific supplies. Again, we get a kid that moves into a district that needs, $30,000 worth of equipment. That pot isn't sitting there waiting to be spent either, right? So Medicaid funds are something we keep aside to a certain extent, and we have that in place for these needs that pop up. So Riften chairs, Hoyer lifts. I'm not endorsing products, of course, but these are the expensive things that we know about out there that pop up for kids that we most certainly need to put in place. Rural schools are hit hard. When we talk about access to services, like Dr. Seipert said, we've got to send people to places to get that. In most of our towns, we have a gas station and a stoplight. Outside of that, we've got great people, but no service providers of any kind. And that's just part of living in the rural area. So it gets very expensive to meet these needs for students and families and put the things in place that are going to really help them in the school setting. So there's a tremendous impact to our schools from a national level. Students are protected by the Individuals with Disabilities Education Act. And from there, every state has their own version of IDEA that generally goes above and beyond what's required in federal statute. So there is no escaping per se from providing services to any students. A, we should do it as a number one best practice, right? But B, it's federally and locally required by many laws that have been established since 1975. So IDEA is celebrating its 50th year anniversary. And I think to cut back on one of the pinnacle points of funding, getting these services in place, Medicaid, cutting that on the 50th anniversary is just a real disservice to our states, our nation, and the students that we all serve. Ultimately, our kids and our families are impacted when the services don't get met.
Thank you so much, Joe. Yeah, I absolutely. I think we're all nodding our heads in agreement, and just really appreciate the areas you lifted up. One thing I think I want to pick up on and turn to you, Heidi, next is just that flexibility that Medicaid provides, that flexibility for states and for districts to really determine how best to serve their student needs, address the needs of their specific populations and the needs that they're cropping up. And so I think that's really an important piece of that, is that there's a lot of the Medicaid gives local entities the opportunity to determine best how to serve the students that they serve. And so I think you mentioned that, and I would love to now hear from Heidi too, if there's more you'd like to expand on there, and just talk a little bit about how Medicaid works in your districts, how it's, thinking a lot about what Asheville's been through this year, and wondering, how Medicaid has played a role to really support your students, and what would be on the line in terms of the ability to serve students if Medicaid's cut.
Well, I could really just about say ditto for all the panelists that have already spoken, because I did in my 34 years of being in this role in 2 states, I have been in about an equal number of rural and now city districts. And the challenges are so many are shared, but then so many do differ. So when I was in my rural district, just like Dr. Sipe and Joe have talked about, we couldn't find the people to employ if we wanted to. And contracting all of these therapists that we needed to serve our students was ridiculously expensive, and yet not even the best model of delivery, if we could find them. Flexibility is a great point. I have that in my notes because I think that is what the Medicaid piece allows us, is a little bit more flexibility. To give you just a little background in North Carolina, because a couple of points were made earlier in the presentation. We may be, well, I won't even say maybe, we are unique on a lot of levels, and not always in a good way. In South Carolina, part of the way I got more involved with exceptional children when I got to North Carolina was because South Carolina already had a weighted pupil model to fund special education, but in North Carolina, there isn't one. And I've been serving on a committee to help develop that model now, because that is one of those critical things, as the other speakers have already mentioned, the increasing cost to address the more advanced needs our students have and the more services that they need is just simply not addressed in a flat per pupil formula of funding. And to someone else's point, IDEA is a great program, but with what uncertainty we deal with in Washington right now, we've been told IDEA will stay in place, but will it? Will the money? Will it just be in principle? A few years ago in South Carolina, they tried after the recession, the last great recession, to reduce not only, well, during the recession, they had to reduce exceptional children funding there. And then once the economy rebounded, they didn't want to put that money back. And it's the federal government that jumped into that situation and said, no, that's not okay. We understood the reason you had to cut funding during the recession, but now that funding is back and it needs to be restored to that program. It took several years of a court battle to get that money back. Medicaid in North Carolina had not been expanded until year before last. So here, right at the time when we're talking about cutting it, we finally have expansion that people have waited almost a decade for. The other thing in North Carolina, just to put a little perspective on a comment made earlier about, well, if we don't get Medicaid money, we have to raise taxes. Well, in North Carolina, we are one of a handful of states that still caps our state funding for exceptional children, special needs population. So the most money a district can get is 13% of their population. Well, right now, 81 out of 115 districts exceed that percentage of service for our special needs population. And that cap that's arbitrary and restrictive really helps. It doesn't help us serve any of our population. As all of you know, since you do these services all the time, you understand that, not the majority of our exceptional needs or special needs population don't stay in a self-contained classroom every day. They come out and they get served by PE or music or art. And we're in those positions right now, back to the flexibility aspect of the Medicaid funding. If we don't have some of these pots of money that are flexible, that we can move around and eliminate the silos of funding, then we're not going to be able to meet the needs of any of our students, let alone all the over and above needs our special needs population desperately need to function. It's been very disturbing to me since I got to Asheville, even before the hurricane, how many very urgent mental health needs are here. And we have been very blessed here to have a larger department to meet a lot of those needs of our students, where it was more of a skeleton crew in the rural district I came from. But the cost of meeting those needs is very high here. This is the most expensive place to live in North Carolina. So you can't just offer someone $15 an hour and ask them to come to work. So the rise in costs of salaries and benefits is really, even if we were breaking even on funding, we move backwards every year because of those radically increasing salary and benefit costs. So I guess those are kind of the general points I wanted to make in letting other states know where we come from, because the other thing we don't have the fortunate opportunity to do is raise our own taxes. In North Carolina, school districts can't just levy a tax and say we need this much money, or at least suggest it to a county. We actually are at their mercy. So we are actually in this situation right now between a rock and a hard place, because if we can't get flexible funding and more funding, then we can't serve, like I say, the needs of any of our students appropriately, let alone our special needs population. And it's very frustrating because, as we all know, I think every place everyone on this panel lives and works right now, assessments are high. Houses are selling for a lot of money, but we have local and state legislators that keep cutting tax rates back. So there, as much as we could benefit and provide these services with the funding that's available, we can't do it because they keep cutting back the opportunity to raise the tax revenue that's needed to fund the programs. So honestly, I just feel like we're kind of coming at it from all sides. In our tiny district, which we are tiny amidst a very large county district, we only have 3,900 students. But Medicaid does provide $300,000 to $400,000 a year. I mean, if you think of what $300,000 to $400,000 a year does, which is about 10% of our federal funds, and represents about 30% of our state funds, it's just very disheartening to think that, like someone said very, very poignantly earlier, that we could start moving backwards. I mean, we have all, I think, seen a way to make things happen, to make positive changes for our students. And the last thing we want to do is see that progress go the other way. So right now, I think Joe made the best point for me. He spoke to all the points that we do. We actually really save this money to some extent, because we never know what student's going to walk through that door with advanced needs that we have to meet. So this actually at least lets us have a little bit of a catch as far as that. We've been able to provide a lot of equipment that would have been difficult to provide before, like a lot of the respondents said, and that we have also been able to provide some stipends, and at one point, when they couldn't get fully staffed, hiring bonuses and those type of things that we couldn't necessarily provide with our regular funding streams.
Heidi, thank you so much for that, and really to speaking to the incredible role that Medicaid plays now. And I think also I heard just the strain that, it's the strain on budgets and staff, what will happen if those cuts occur. That, when you said it'll be between a rock and a hard place, I think that is exactly what a lot of districts are facing. So thank you so much for sharing that. As we wrap up, I just wanted to turn to Shauna for one more comment. I know you had an example, I think, that you were going to share about just from the work you do, how Medicaid plays such a vital role. So I'll have you turn that, and then we'll close out the panel. But thanks so much again to all of the panelists for joining us today.
Absolutely. I wanted to share with you a story about a 10th grade student that we have in our county. I want you to listen to all the Medicaid touch points when I tell you this story. So this student is a social student, friendly, energetic, optimistic, persistent, resilient, among many other things. He's really quite amazing. So although he recently experienced an anoxic brain injury, he continues to make the most of each day. He lights up every room. He just really lights up the school with his bright and contagious personality. So he uses a communication device with eye gaze technology that allows him to have a voice. So this device, paired with a Chromebook, provides him access to his least restrictive environment, which, believe it or not, is general education with a paraprofessional. We call them independence facilitators here. So through this assistive technology, he is able to complete differentiated assignments and assessments. He is engaging and participating in collaborative work within the classroom, as well as participating in social activities such as a peer-to-peer program. It's called PEEPS here in this district. And the student also enjoys even attending athletic events in the district and going to games and football games and things with his peers. So through his eye movements and then through touchscreen technology, he's completing math problems. He's asking and answering questions. He's making jokes. You know, he's a 10th grader. And most importantly, he's advocating for himself. So recently he was able to express that he was not happy with his adjusted schedule. And he went into great detail about this. So he went into why he doesn't like it, what he wanted everyone to do about it. And so by being able to communicate in this fashion, he was able to get a jump start on planning his own schedule after the semester change so that it would be meaningful for him. So he really, you know, he continues to be a huge participant in his general education classes. The team, the school, his peers, they've all gone above and beyond to make it meaningful and enjoyable for him. But he's also just really determined. So when you cross his path, you'll see him continuing to work toward increasing his mobility outside of his wheelchair. That's been his most recent goal now that we've got his ability to communicate intact. So I just wanted to share that with you. I'm sure you could hear from assistive technology to all the personnel to his wheelchair to thinking about all the ways in which Medicaid funding has provided support to make this student be able to be successful in the gen ed, you know, a very, for him, least restrictive environment. So this is one very big success story that without all of these people and capacity and device support, assistive technology, personnel, we would not have been able to probably accomplish as quickly or easily. So just wanted to share a success with you because it's always nice to see the direct impact or hear the direct impact to our students. Thanks for letting me share that, Jesse.
Yeah, absolutely. Thank you, Shauna, so much. That was perfect. It was really powerful. And also just, I think, you know, I'm sure you all the panelists have similar stories that are just inspiring and really help, you know, help share the many different touch points that Medicaid plays in a student's life and really what is at stake, the many different areas that are at stake. So thank you all so much. With that, I'm going to just thank you all so much again for joining us, for taking some time out of your busy schedule, and appreciate the work that you all do and the service that you provide every day for our students. It's not easy work, and we are so grateful for all that you do for kids across the country. So thank you so much to our panel. I'm now that we've heard what's at stake, I'm really excited that we have some time to talk about some of those advocacy opportunities and how we can get involved to protect Medicaid. So I'm going to introduce Sasha Podolsky. We're so lucky to have her here with us to walk through some of those advocacy opportunities. Sasha, for those of you who don't know her, is the Director of Advocacy at AASA, or the Superintendents Association, where she leads the advocacy and policy team there. Sasha is also the founder of the Medicaid in Schools Coalition, which is a coalition founded in 2017 to protect Medicaid in schools and the vital role it plays for students, as you just heard. So Sasha, thank you so much for joining us and talking about the ways that we can start to get involved and engage on this critical issue now.
My pleasure. It's what an amazing panel we just had. And it really, especially Shauna's story at the end, really kind of keys up what I wanted to talk about, which is the importance right now that all of us as advocates for the school-based Medicaid program act as storytellers. You know, people can think about numbers and cuts and dollars and not think about the kids who are impacted, the children, the lives, and the kids in our programs in particular who benefit so much from our school-based Medicaid services. And as advocates, we are able to bring those stories to light in meaningful ways that make people, just like Shauna did, really understand how these cuts will have profound impacts. And so my advice, or I would encourage everyone who cares about this program to think about the stories that you can tell, and think about the data that you can tell too. Certainly, you know, if you're not sure how big your program is or how many kids in your district get Medicaid, we dropped earlier in the chat some resources from Georgetown, for example, where you can see your school district and the percentage of kids who rely on Medicaid there. And certainly if you have someone at the district office, they can get that information to you, those percentages. But even more than numbers, again, are the stories. And tell those stories not just to folks who are on the same side as you on this issue, but to your communities. At your PTA meetings, talk to parents about this proposal and the devastating impacts it would have on the critical services that they really care about their kids receiving, like mental health services. Explain why Medicaid in schools matters to business leaders and others who are invested in the success of your district, and make sure that you're telling your story at the local level, at the state level, and then most importantly at the federal level. So we're very happy that today we have an easy opportunity for you to take action through a QR code that we have that was done in partnership with our friends at the National Association of School Psychologists, where you can right now use your phone, take that photo of the QR code, and you'll be sent to a pre-populated message. We encourage you to customize that message though and reflect who you are, the district, any information about who gets Medicaid or what it means to you from a budgetary perspective if these funds were to go away, and to use that to send hopefully the first message around school Medicaid for this Congress, but most likely not the last. As was discussed before, this is going to be a big year for our Medicaid program, as there will be a lot of people looking at it to pay for things. And so while this attack right now through budget reconciliation is significant, it may not be the last time that we see proposals to cap Medicaid funding or cut Medicaid funding come up this Congress. So really encourage you to start figuring out how you're going to communicate and share your story, again, at the local level, at the state level, and then importantly at the federal level. We can't have folks hear these stories often enough. Don't feel like that you've said it before, so you don't need to say it again, or you said it a few years ago, and so they must still remember. Turnover on Capitol Hill is rampant, and so even in the same office, they may have 2 staff in 3 or 4 months. So make sure that you are reaching out, talking about the fact that this is a critical program for your kids, and that you oppose any attempts at the federal level to dismantle the school-based Medicaid program and cut Medicaid overall. So with that, I'll turn it over to Allison for final remarks. And thank you so much for spending time with us and engaging with us today.
Thank you so much, Sasha. These are all really wonderful ways to get involved, and we really appreciate you sharing your expertise on just advocating for such an important issue, as we've heard so much on today. Again, as you'll see on the screen, it takes really just minutes to use your voice to urge your congressional representatives to reject all proposals to cut Medicaid. We'll be sure to share this action alert with everyone on this webinar as follow-up. But then moving ahead, as we close out today, I want to remind you all that we will also be sharing a bunch of other resources with you, so many that you've seen come through the chat today, post-webinar. And that it also includes the ones that you see here on the screen, which come from Healthy Schools Campaign and numerous other partners in this work that provide great data and information on protecting schools and protecting the Medicaid program overall. And so before we close things out this afternoon, just to our next slide, I want to take the opportunity to really share immense and sincere gratitude to our partners. Thank you so much to all of the school district leaders, especially those who are on our panel this afternoon, who shared so many insightful and powerful reflections in our survey and in the panel today. And thank you to all of our partners who helped to distribute the survey and contributed their time and expertise in the new report that was released today and across all other efforts to protect Medicaid. So again, AASA, NAME, CASE, and the Association of School Business Officials, thank you so much for your partnership on this work. And so with that, thank you to everyone who joined us for this webinar. Healthy Schools Campaign will continue to provide education and advocacy to our network during this really important time. So please stay in touch with us, sign up for our HSC health policy newsletter, our HSC newsletter for news and action alerts. Together, we can truly continue to build on the success of this program and to safeguard it into the future to support the health and well-being of all students. And so as you can see on the screen here, my contact information, as well as that from my colleague, our National Program Director, Jesse Mandel, is listed here. And we'll also be sharing that in the chat with you. Please contact us for any further questions about the survey or how to get further involved. And again, we just appreciate everyone on this call, and thank you all, and have a wonderful rest of your day.